Okay, guys, while we're waiting, I am Michelle with Insurance Advisors Direct, and today we're going to be talking about CONNECTURE, which is the enrollment platform for Priority Health, and it's very user friendly. So, excited to be able to show you some things today, and then if you have any questions, we can answer those at the end. Well, and happy
Yeah.
Valentine's, everyone.
Yes, right? I think
Okay,
I forgot to mention that on my what's everyone see here?
okay, we see your Google screen.
Perfect. All right. So I'm on Google screen because this is a Connecture training, if I recall. And Connecture plays well in the sandbox with Google Chrome. Okay. So make sure you're in Google, not Firefox or any of the other platforms, whatever those might be. I don't know. So I go to Google and then I will go to my login here and I will make this a full screen so that's a little better. All right, so once you go to the login, there's two things you can do from here. You can access the Agent Center by clicking on Medicare. That is where the cell sheets, the forms, the EOCs, the summary of benefits, AOR forms, like all that stuff is in there. You can also access the MAPD, the Medigap, the DSNP products. All that stuff is in there. The enrollment platform, however, is over here to the right. Hopefully, you guys can see my mouse. The Medicare Enrollment Plan Year 2023. Okay. So we're going to click on that. And I'm not sure of the level of activity each of you guys have had on our enrollment platform or even within our agent center. But what I'd like to do is just kind of walk through a couple of scenarios. This platform has an awful lot to offer. I'll probably walk through some of the more common scenarios, but feel free to kind of stop me if you'd like, or raise your hand. Let's see, I will put chat on, so if there's any questions there. But this will be your dashboard once you do log in and click on the 2023 Medicare enrollment tile. Just a couple things I'll point out here on the dashboard is as you go through and start entering clients, profiles, and so forth, they will show up depending on what's going on here. You can see I have Clark Griswold under enrollments, quotes that I've sent, also Clark, scopes of appointment, Judge Schmales with a G. Why I did that, I have no idea. Must have been a long day. And so different scenarios here, and then other as well. So one thing that some agents are certainly doing is using this as is almost like a CRM, right? Because you can leave tasks, you can leave notes within each beneficiary profile. So just a bunch of things you can do here. We also do have Find a Doctor because that's always the first question that you're asked. That's often on each page that you can access. You can do a search profile, create a new profile, and then under your profile as the agent, you can run reports, which you can also see over here. You can run enrollment reports, you can run scope of appointment reports, and health risk assessment reports. We do have the ability to wait 30 days from the application submission to do the health risk assessment and get paid that quote unquote administrative fee. So, once a month, maybe run that report and see who you haven't done the health risk assessment for, just a tool to kind of keep track of that. There's also how-to materials where there are videos as well as PDF sheets that you can access either through here or here. And then a log out, of course, and then account overview. Account overview is nice because it gives you your information that you can update. But also what it does is it contains your marking or shopping link. This is your Pearl that you can access. All you have to do is click, left mouse click on copy link, and then you can paste it anywhere. Put it in an email, put it on the website, what have you. But I will copy that real quick. Ooh, I right clicked instead of left clicked. So you can see it says copied, and then you can do this in an email. You can do it wherever. We'll just put it on here so you guys see what that looks like real quick. And I will paste it. into a new sheet here. And so any business that you drive through that Pearl, each of you have your own specific enrollment link. Any traffic you drive through that will send them here. It's the enrollment site. However, as you see up above, it'll indicate your contact information here, right? So any traffic you drive through this, you would receive credit for. All the beneficiary does is add their zip code and they're off and running. They add their zip code, it will instantly show them the plans available in that zip code, and they can enroll right from there. One thing I do like about this, however, is it does provide your information so that they can access you, right, instead of calling us and the 800 number. Because on occasion what will happen is, oh, that agent of mine was so nice, they spent an hour with me, I don't want to bother them, I'm just going to call and enroll directly, without them really knowing or understanding that at that point they're most likely no longer you will no longer be their agent of record. So we do have measures in place to correct that, but let's avoid it if we can. So what I will do is I'll go back to the dashboard. The first scenario I'd like to kind of do is, I think the most common, at least from the feedback that I get from agents, which is I met with the beneficiary face-to-face because I don't want to record all my stuff, and that's a pain, and I want to develop that relationship with my beneficiary, help retain them, et cetera, et cetera. So I'm going to go obtain a paper application, do my paper scope, and now what do? Come back to either the office or your home, and you're going to enter that paper application electronically. Let's say you haven't created a profile for this particular beneficiary yet, so you're going to click on New Profile. All you need to do to create a new profile is indicate zip, first name, last name. That's all you need to create a profile and move forward, because you can see there's the red asterisk next to those. Wherever there's a red asterisk, you would need to complete before the system would allow you to move forward, right? So if I didn't put the zip and just put the name in here and click save, and then try to go somewhere else, it would prevent me, because I have to at least enter the zip as well. Now, any information you include in the beneficiary's profile will automatically populate on the application, so it's not duplicative, right? So that's kind of nice. So
Hey,
anything I put in here, yes.
Rob, I have a question. So going back to using the profile, if somebody is going to enroll that way, at what point do you do the recording? So
Great question. Yep. So what you could do is, if you are going to do a recording as opposed to the face-to-face, right? So for the example that we give, and I will just put in here my info because it populates real quickly. I'll click save. Oh, I didn't select the county. So see, it stopped me. So it goes back, add the county, click save. So that's saved. And now I'm going to have some options, right? I can go to preferences, continue to scope of appointment, or continue to plans. But you'll notice up here, it'll say start call recording. Okay. All you do is click on that. So if it's a different scenario than we kind of mentioned, where you have a paper app, you met face to face, and you want to record a call and have it, it's not face to face, at any point at the top of the screen, and you'll see that kind of follows it, right? Start call recording. You could start that call recording. So let's say you're, talking to a client, right? You're talking to a client. Maybe that conversation transitions into sales or marketing. At any point, you can click that start call recording. One suggestion that I make to agents is create your own profile here. Add your phone number, add your email address, and go through these processes so that you see what it looks like from the beneficiary's end, right? So create your own profile here and then click call recording, start call recording. What'll happen is it will bring up this page here, and it will tell you this is the number within the profile, right? That it will call. All you do is click call beneficiary. But it does also provide you, so that you can convey to the beneficiary what number this call is going to be coming from, that you hopefully can see right there. So if you create your own profile here and then, click call beneficiary, you'll receive the call on your phone, and then you could better describe that process to the beneficiary when you need to make that, call to the beneficiary. So I highly recommend doing your own profile and kind of just going through some of these steps, right, to do that. One of the other steps that I recommend is going to the scope of appointment. So if you click on scope of appointment, it takes you to this page, where you can either upload scope of appointment, right? You can print off the form, or you can complete the scope of appointment in person or phone, or you can email or text the scope of appointment to the beneficiary here. And because I put my information in here, it would do that. You could do both. So again, this is another reason why I suggest you create your own profile and then do this. Send it to yourself via text, send it to yourself via scope of appointment to see what the beneficiary receives on that end, so you can better kind of walk them through that when that happens, right? A lot of times what I'll do is ask an agent, what's your phone number? And I'll send it to them. It'll show up instantly. What it does is it'll show up instantly on the beneficiary's phone or in their email. They basically check the boxes of the content that they want to discuss during the appointment. What I advise the agent to do is have them select every box. Just select every box, right? That way you don't have to go back. And if that conversation rolls into something else that they did not check, it will prevent you from having to go back and get and acquire another scope of appointment, right? So you're just kind of protecting yourself from that standpoint. But create your own profile, walk through this, send these to yourself, see what that looks like. Again, if you did a paper app like the scenario we discussed, you can upload it here. And we will retain the recordings as well as the scope of appointment, etc., for the required amount of time. If there's ever an audit or whatever, we will retrieve those for you. What else was I going to say? Oh, um, you do not have to have a scope of appointment saved within the beneficiary's profile in order to submit an application. Okay. So maybe you did, like the scenario we were talking about, you go meet face to face, you do a paper scope, you do a paper app. You don't have to upload that scope here in the beneficiary's profile in order to submit the electronic application. If you're the type that wants to hold that in your file and keep that, by all means, go ahead and do that. So this is not something you have to complete in order to submit that application, okay? One of the other things that you could do is add preferences. What this does is just round out that beneficiary's profile. You don't have to do this if you don't want to, but it basically gives us a better understanding of the beneficiary so that when you get to the point where you have the expected out-of-pocket for plan to plan, it'll give you a little better idea as to which plan maybe is best for them. So we ask questions like, what's the health of the beneficiary, right? And we give you some definitions here. So generally healthy, if you select that, or you could select some health needs or significant health needs, whatever you select here, we will apply to the expected out of pocket based on the plan you're looking at, right? It'll include the 2 prescriptions and 2 visits. You can select the age, for example, right? You can add prescriptions. Now, this isn't anything you have to do, but you can do it if you want to round out that profile. Here, you can just do a search for prescriptions. I just always type in any random 3 letters, and it's amazing what pops up, right? You only need 2 letters for them to pop up. I've never heard of any of these drugs, but you could select those, and as you select those, it will indicate on the back end when you select the plans, is the prescription on the formulary, what tier it's located on, the cost for annual cost, the cost of the monthly cost, the cost prior to the donut hole, during the donut hole, after the donut hole. So it obtains all that information that you can certainly provide to the beneficiary if needed. This down here allows you to enter the beneficiary's email address, and it would send the permission to the beneficiary that would allow you to drag over from Medicare.gov, their profile, which would contain their prescriptions as well. I don't know the percentage of beneficiaries that have their complete profile on Medicare.gov updated, but if it is, this is another option. So maybe they've got 12, 15 drugs and you don't want to sit here and type out each one of them. You could send this to the beneficiary. The beneficiary gives you permission. The platform will bring that profile over containing the drugs to the platform. It'll load those automatically for you. So just another option. The last thing under preferences is pharmacy. You can elect the pharmacy. It will automatically pull up the zip code. Pharmacies within the zip code. You can go through and select a primary one and a secondary one. From there or from anywhere, you see where it says, go to plans, will take you then to the plans. So once you've created the profile, again, all you need to do this is zip code, first name, last name, and then you could select go to plans and it would take you here. We kind of went the long route, showed you the scope, showed you how to round out that profile with the drugs, with the all that stuff. Don't have to do any of that. If you just enter the first name, last name, and zip, and then click go to plans, this is where it will take you. It will automatically pull up every plan available within the zip code provided. It will also offer you the supplement plans as you see here. Currently 9 plans in Livingston County. I will point this out. DSNP plans are not automatically added. Why? I don't know. I would much rather have them be available and then you can filter them out. Whoever put this together decided to filter them out, and then you could add them if you wanted to. If you want to add the DSNP, you just click on this right here and you can see the DSNP plans popped up. Okay. You can filter these in a number of ways. Usually by the time you get to this point, you probably have a pretty good idea as far as what plans you're going to enroll in. If it's the scenario that we initially indicated, went and met with the beneficiary face-to-face, obtained a paper scope, paper app. You already have that paper app. All you need to do is the zip, first name, last name, click go to plans, and then just click go to cart, right? Or add to cart. And that will start you down the enrollment process. Some of the things that you could do if you did round out the plan, right? And you do see they do show the 5-star available here as well. Here's the key plan, 5-star. Some of those things that you could do is plan details, right? So maybe you haven't completed that or you want a little more detail. It pulls up the summary of benefits that you could walk through. If you added prescriptions, and it gives you the chance, we didn't add any, but it would give you the chance to add prescriptions here as well. Just by clicking on that, any prescriptions you add, it would indicate the tier, the out-of-pocket, pre-donut hole, during the donut hole, post-donut hole, both on a monthly and an annual basis. So a really nice resource there. Health costs, what they would go here is if we indicated, relatively healthy, it would apply those 2 office visits. And then, the total estimated cost, right? It would build both prescription and healthcare costs here. So just some really nice details that you can get into to provide the beneficiary if they're asking, right? Then we also have some frequently asked questions that you could look at down here to assist. So just some nice resources there. So we'll click previous, and again, kind of get back to that scenario that we first mentioned, which is, met face-to-face, do the paper app. Enter the zip, first name, last name, go to plans, and here's where we're at. We'll say it's the key plan. So we'll find that, and we'll click on add to cart. If it was a scenario where maybe you had a conversation with the beneficiary over the phone, right? And they kind of hem and haw, and maybe I'm not real sure, I want to check on a few things, whatever. Add to quote. You can send up to 3 plans via email and quote, and the beneficiary can enroll from that quote that you emailed them. Okay. So if it's a case where you're having a conversation and they're not real sure, hey, I understand. Let me send you a quote, right? That'll give you the opportunity. It sends the summary of benefits. all some great information, but it gives them also the ability to enroll from that quote that you would receive credit for. So just some really nice tools that you can access, right? And of course, that Pearl that you could also add as well. So we're going to get back to that original scenario. You met face to face. You've got the paper app. All you want to do is enter it electronically. The zip, first name, last name, save, go to plans, and then you're going to add to cart.
So Rob, just,
Yes.
I know a lot of people get really nervous about meeting the CMS rules in terms of that call recording. Is
Hmm.
there just a straight answer in terms of when to actually, I mean, is it when you're talking about these plans, like right here? How far do you have to go in advance and starting the call to ending the call? I
Yeah.
know that's always a question.
Yeah. Yeah. Yeah.
Not to put you on
So
the hot seat.
no, that's great. I mean, that's why we want to do these. So, I think there are some carriers, like just like any new law or relatively new law, carriers may interpret that law a little bit differently. Particularly healthcare reform, right? If you recall when that hit 11 years ago, carriers interpreted things a little bit differently. And I think we're perhaps in that stage at this point. And I say that because some carriers, I'm told, are sorry about that. Some carriers, I'm told, are indicating that a webinar may be face to face or may not be. The way Priority Health is interpreting the law is that a webinar is not face to face and needs to be recorded. Okay. The only thing that Priority Health is considering a face to face is if you're physically there face to face with the beneficiary. Okay. So, what CMS has said, and any of you who went to the Madahu Medicare Summit this year down at the casino in Detroit, if you recall, there was a young lady there at the end of the presentations, and I had an opportunity to talk to her a little bit further because one of the things she mentioned when she was on stage is that CMS wants you to record every call. CMS wants you to record every call, but you only have to save marketing and sales calls, which makes no sense whatsoever, right? So I had the opportunity to talk to her afterwards, and I said, look, when CMS unveils these rules to you, are they laughing like, we get it, this is ridiculous? Or do they have a straight face and think this is really important? And she's like, no, they understand how ridiculous it is, right? So I was kind of glad to hear that. So technically, CMS wants you to record every call. However, the only ones you're supposed to save are calls that contain sales or marketing. So you have the ability to reach out to your existing book of business, right? So maybe I'm calling my existing client and, hey, just wanted to see how things are going this year. Did you like the plan? Did you want to look at alternatives, etc.? Technically, CMS is saying record that call. Now, it's not a call you'd have to save until that beneficiary says, yeah, you know what, I would like to look at some other plans. And you got into having that conversation. At that point, once you start going over other plans, benefits, etc., now that's a sales marketing call, and technically you would need to record that and save it. Okay. Now, also, what CMS says is if a beneficiary refuses to be recorded, technically you're supposed to hang up. Like, this job's not hard enough selling an extremely complicated product over the phone. Now you have to hang up if the beneficiary says, no, I don't want to be recorded, right? So it's, it's one of those things where the way I recommend that is if I go by the letter of the law according to CMS, record every call, but only save those where the conversations migrate into sales and or marketing. Okay. Um, Again, this is why I think a lot of agents' preference is to start going face to face to avoid having to do that. However, it does limit you in regards to how big of a book you could have, right? It takes a lot of time to drive and meet face to face with clients. Doing it over the phone or via webinar is a lot more convenient. You talk to a lot more people in a day via webinar or phone as opposed to face to face. So technically, that is CMS's stance. So any
No, I think
additional
that that
questions?
was, yeah, no, that's great. That clarifies my question, so.
Sure.
you-
And anyone who does record calls on our platform, we will hold those and retrieve those as needed, right? Um,
So are we able to delete those calls that are not pertinent to a sales or marketing situation within the system? Or do we have to have somebody on your end delete those recordings?
it's a good question. I don't know if we will save those calls. If you want a call deleted, um, I don't know if you have that capability to delete those yourselves, or is that something that you would have to reach out to us to do? It's a good question.
Okay,
Um, all I know at this point is that we will save those calls. We will retrieve those calls on your behalf if ever needed to do so, right? If there's an audit, if there's a complaint, etc. I will say up to this point, I've had a few complaints that I've investigated per CMS guidelines. I noticed on this last one, the question from our compliance team, was it face to face? Was it not? Um, I don't know to what extent CMS will go if there is not a face to face and there is no recording. I don't have any gauge on that yet.
mhm.
I know a lot of people are saying that most likely they're going to be a little lenient as this law rolls into place. I wouldn't count on that. You know what I mean? I wouldn't lay my cards on there. Of course, I'm not a betting person to begin with. For me, it's donating because I never win. So,
Yeah, so
um,
to be on the safe side, just recording every conversation is gonna be the way to
yep.
go.
If you're asking me
And
as a
that
rep,
doing
what
that,
would I do and how am I going to train agents? Record every call.
yep,
Record every call. We'll save them. We'll retrieve them for you. If it's a call that does not contain sales or marketing, don't have to have it, right? Don't have to save it. But CMS guidelines at this time reflects that you should record every call, but only save those that are marketing and sales. So,
okay, good.
figure that out, right?
Yeah,
So we've added our plan to the cart, just like Amazon. I think that's why we did it that way, because everyone buys stuff online except for me, although my wife makes up for both of us. So um, it will indicate the plan that you elected here. It gives you again the chance to view the details, change the plan or remove the plan. It'll indicate the premium. It does give you the ability to add the optional enhanced dental vision. It will tell you what the price is for each plan. It will allow you to view the details for it as far as what it contains, which is nice. And all you have to do is click add to add it. You see the $29 there. This is the first important question that you will answer in regards to completing the application. Um, and the reason I say that is because what you elect here will determine what's available to you on the back end for the signature. So how will you be completing this form? Send to beneficiary to sign and submit. So if it's not face-to-face, if it's a webinar or, excuse me, just a phone call, That's what I'm going to elect, right? Because I need, when I say I mean the carrier needs a signature. It either has to be an electronic signature or a paper signature, right? With a paper application. So given the scenario that I first presented, which is, you go and meet face to face, you have your scope, you do your paper application, right? Because you don't like the recordings. You're going to select complete and submit form myself. Okay. Again, if you didn't meet face to face and you were recording the call, it was a webinar, whatever, you need an electronic signature, you would select the first one, send a beneficiary to sign and submit. So we're just going to continue to apply at this point. And again, the reason for that is it will give you the option you need on the back end when the signature comes up. So the information that we populated within the beneficiary's profile populates here. Anything that I did not add, I can add. So I didn't include the date of birth. I will simply add that now. Today I identify as male, phone number. And again, you can see the asterisks here as far as what needs to be completed. Would you like to receive? I'm just going to say no. Do you have an alternate phone number? I'm just going to say no. And then the address, mailing address different. I'm going to say no. So let's see if I did everything correctly. If I didn't, it would have prevented me from moving forward and indicated up above, what I needed to change. So I have a made up MBI number. We'll just say my effective dates, right, for Part A, Part B. Requested effective date, we'll just say 3/1. Do you want to enroll in or continue your current enrollment in the enhanced dental and vision? So this gives you an option again to add it or eliminate it, even though you already did, right? So we'll just say yes, we want to continue to enroll in that. And then as you'll see here, I'm enrolling in 5-star Medicare plan. It's the first one to elect, and we'll just pick that because that'll be fun. One thing I will point out here is on the paper application, we printed those before CMS came out with the star rating. So on our paper applications, the 5-star SEP does not show up. So what do? You make your own. Draw a box, write 5-star SEP, and check the box. That's all you're going to do on the paper app. When you come here to enter that paper application electronically, it is available. We were able to add that once we knew we had achieved the 5-star. One other thing that I will keep in mind, I elected the key plan, which is an HMO POS. The key and the 1 are our 5-star. We do have 4. 2 of those 4 are legacy, have a premium tied to it. The 2 that you'll probably focus on 95% of the time are the key and the 1. Those are 5-star. If you elect by accident a PPO plan and choose the 5-star SEP, this platform will not prevent you from submitting that, even though the PPO plan is not a 5-star. It will get submitted to CMS. CMS will reject that application because you elected 5-star and not a 5-star plan. Okay? Be very, very mindful to select either the key or the 1 if you elect the 5-star SEP. Okay? The platform will not filter that out if you select to enroll in a non 5-star SEP, but elect a 5-star SEP enrollment option. Okay, so any questions about that? Prescription drug coverage, I'm just going to say no, we don't have any additional, and I'm not Medicaid eligible. So click next, see if I missed anything. I did not. Now we're going to have other information. You can see ethnicity and race. There are no asterisks here, so these are things you can answer if you choose to. You don't have to. I always like to select Spanish Braille. I don't know if that's a thing. Is Braille just Braille in any language? Huh? I don't know. Good. Anyone know the answer to that? I'm just going to say I do not work. I'm going to say my spouse does not work. If you indicate that you do, additional categories will pop up there. Are you enrolling because you are leaving or have left coverage? If you indicate yes, it'll give you the ability to enter that information of that group plan. I'm just going to say no. All right, now here's the other important thing. Other than that election of are you completing the form yourself on the front end, or you need to send it to the beneficiary for an electronic signature, that's the one little nuance that you want to make sure that you get right. Really, everything else is just complete, right? Fill as you go, just like completing the paper application, so to speak. Finding the doctor or the physician search is the other little nuance that I think we didn't quite get right and needs just somebody to kind of show you what you're doing there. So the tendency here is, we chose an HMO POS plan. They're going to want us to select a PCP. Your tendency is to click on this box here, but it won't let you do that. I haven't got a ton of calls on this, but I have gotten some calls where the agent says, hey, it won't let me find a doctor. Well, all you have to do is click over here to the left. Why we didn't place that right over underneath here, right? I don't know why. But all you have to do is click find a doctor. It will take you here. You can enter the zip code and the last name. It is first name first, last name last. So keep that in mind. Some people will enter the last name under the first name category. You can adjust the mileage here as well. Just say Smith, and as soon as I type in a name, search pops up. It will search each of the Dr. Smiths within 25 miles of 48178, and you can see them listed here. There's quite a few. All you have to do, and this is another area where people have gotten clogged up, you'll notice a very faint box over here to the left of the doctor's name. All you're going to do is click that box, and as soon as you do, you'll notice choose highlighted in blue. So all you're going to do is select the box, select choose, and then it will take you back to the application with the doctor's name in there. Okay. So again, just find a doc over here. I would have liked for us to put that over here a little more visible. Someone kind of running through this, but just something in mindful there. And then do you want to get a bill? Do you want to do electronic funds transfer or automatic deduction? So depending on what you select, it'll give you the ability to, enter that information. So I'm going to just select a bill, go to next. And so really, other than those two things, it's just kind of walking right through. So it's got agent information listed here. See, it's got my information. It says internal sales rep. I'm not sure why they have me listed as that, but you agree. Click next. Here it gives you the ability, again, to review and submit. I didn't really point this out, but you can see the steps up here. We're at the review and submit. So it does give you the ability to kind of click each of these drop-down boxes, review the information that you've entered, and the ability to edit it if needed. You can see here. So just a really nice platform. And then you're supposed to stop and read to the beneficiary all this stuff that CMS requires. Fun and exciting. You're going to indicate, I understand. Okay, now we selected that we have a paper application and a wet signature on a paper application. So at the front end, we indicated I'm completing the form myself, right? And you can see the agent signature here. So please select the statement below that best describes your relationship to the person with Medicare listed on this enrollment form. I am the person listed on this enrollment form, or I am simply helping to complete this enrollment form. Versus I am the person authorized to act on behalf of individual listed on this enrollment form under the laws. Okay, what they're talking about here is a power of attorney, right? We're not power of attorney. We're the agent who's assisting the beneficiary in enrolling. So we're going to click on that. As soon as we click on that, this box pops up, beneficiary signature. Again, this is the scenario that you're going to do if you have a paper application you're submitting electronically. Okay, and you're going to do that because you can submit it instantly. So I'm the person helping. I click on due to physical limitations, I am unable to sign my name electronically, right? I wish they would have added that here because they've already signed their name on the paper app. Again, we either need a wet signature on a paper app or an electronic signature. We have a wet signature on a paper app. So all we're doing is we're indicating that I'm unable, right, to physical limitations to sign my name. If you do that, all you do is type the beneficiary's name in here and indicate paper application. If you're face to face with the beneficiary, all you're going to do is have them sign their name here, right? And you can clear that. But because we have a paper app, all we're going to do is type name in here, dash paper application. So all we're telling our underwriting team here is that, hey, I've got a paper application with a signature. Okay. So then all you do is sign as the agent and you click submit. That's it. You're done. The first time you do one of these, it'll take you a few minutes because you're kind of reading everything. What did he say about that? Provider, PCP, search, and which one do I select on the front end versus the back end, right? Et cetera, et cetera. After you do your first app here, you will be a pro. You will send these through so quickly. It's great. So let's go back. I want to show you what that looks like. I want to show you what that looks like from the other standpoint. So if we did, let's go back to contact info. And I think it might have been before this. Yeah, I think it is. Oh, wait. All right, so we'll do contact info next. Oh, yeah, I think it is before this. All right, so what I'm going to do is I'm going to go back to dashboard. Now this will have saved, and it'll be hard to locate, but it will save your progress, right? It'll save your progress. So let's say you start that process, you don't complete it. Under your profiles here, you can do a search profile, or you could do here under enrollments or other, right? Where you can find that beneficiary's profile and select it. Once you select that beneficiary's profile, it'll bring you right back to where you left off, right? So it'll save that progress, which is really nice. What I'm going to do is now show you the process for if we do an electronic application and need to send that application electronically for signature, okay? So I'm going to enter this again real quick. We're going to save and continue to plans right away. Okay, and then we'll just do the key plan again. We'll add to cart. So you can see, like, once you've done this a few times, you're just going to run right through it. List that. Do we want to add the dental? Now, complete and submit form myself or send to beneficiary to sign and submit. Okay, so we're doing a webinar. Maybe we're on the phone. So I'm going to select that because I don't have the paper application with the signature on there. So I'm going to select send to beneficiary to sign and submit. Continue to apply. And from here, it's just all the same stuff that we just did. Okay. And you can see tracking it up above here. So I'm going to have to add my stuff again. Not my actual date of birth. Let's say no. Submit. See if I missed anything. Yep, I did. What did I miss? Do you have an alternate phone number?
Phone number.
Oh, so there's an example of if you don't complete something that's needed, it won't let you move forward, which is kind of nice, honestly. So that way you don't have to worry about that. 3-1. We'll just say no, and we'll do the 5-star again. We'll We'll say no, no, next. Any questions while I'm just kind of running through this at all? Find a doctor, click on the box, enter the zip, 8178.
Well, how long before they'll see that book of, that piece of business in their book of business?
Yeah, it migrates over pretty quick. It won't, oh, I didn't put any names. It's pulling up everyone from that zip code. Let's see if I can add that. It doesn't take forever. It's not long. I'd say a week or two,
Okay.
if that. Let's see. We'll get a bill. Next.
And can you, I know agent of record doesn't happen that often.
Hmm.
But when it does, is it just paid on the next renewal? Are they getting paid on the new business as it comes in? Can you explain that?
Yep, great question. So this actually just came up not too long. It all depends on the effective date of the plan and when the AOR is received, right? So if if we submitted an application right now for a 3-1 and an AOR came in on that plan prior to the effective date, the new agent would receive quote unquote new commissions, right?
Mhm.
If that was available. If it came in after, then it would be the renewal, right? Commissions. So it just depends on the scenario. If the AOR is before the effective date versus after, the effective date.
Okay.
Okay.
Mhm.
Um, please select a statement that best describes your relationship. So I am the person listed on the enrollment form, or I am simply helping to complete this enrollment form. I am the person authorized to act on behalf of the individual. Excuse me. So I'm gonna Ken, Ken's name popped up there. I'm not sure why. So all we're gonna do here is your information is listed here. My name should have been listed there. I'm not sure why it wasn't. And then we're gonna send to beneficiary. And so this is an area where sometimes people get caught up because you have to scroll to the bottom to send to beneficiary. It gives you the ability, just like in the scope, to send the signature either via email or text, right? You can include what you want in there. And again, this is this is a case where I suggest that you do the scope of appointment, have the agent create their own profile, do the scope of appointment this way, both via text and via email. So you see that process. It's the exact same process here for the application. Okay. I don't recommend doing the application that way, just in case you were to um, submit an application that's not a true application. I've done that once in one of my trainings, and my underwriting and enrollment team was not real happy with me. Um, so again, this on the back end will determine, or I should put it the other way around. That question on the front end, as far as you having the paper application with a wet signature, right? Versus needing to send that application to the beneficiary for an electronic signature, um, dictates what options you'll have on the back end. So my preference would have been you have both available on the back end, right, to elect whatever you want. Not a big deal. Like I said, after you've done this once or twice, you'll be a pro at it. You'll run right through this. It'll take you no time at all. Um, any questions about any of that? I can go back to the dashboard. So let me pull up a beneficiary and just see what we've done here. Okay, so here is, I'm not sure why his info is not showing up there. I think I clicked on the Clark Griswold profile, but this is just an example of what you can access in the beneficiary's profile and what it saves, right? So on this particular profile, again, the name and all the information should have popped up there. I'm not sure why it didn't. But you'll see under the notes, I sent scope of appointment to the phone number here, credited, 123. So it just gives you a really nice, here I did a call recording, so it'll save that. Application was sent, gives you the code. So just a really nice platform. And then it also shows tasks, right, that you can add, and that would show up in the dashboard. So, and then at the bottom, it'll show you, right, that application that I didn't complete. So I pull up that profile, I could continue the enrollment. Right here, I've done a couple of different trainings. And if I go to the scope of appointment, oh, that's asking for that information. Let me do a search. But if I go to, the scope of appointment for, the beneficiary, that scope is accessible. I just have to find one that I did. You can see I've done a lot. Applicant, let's see if I did a scope for one. Let's see if this one was one we did a scope for. All right, so there's the info. So if I continue to scope, I don't know if I did one for this one. Yeah, I didn't. But if I had done a scope for this, you'll see the scope of appointment would be accessible here. It would provide you all the same information that application did with the confirmation, where it was sent, when it was sent, if the beneficiary completed it or not. Once the beneficiary completes their end of the scope, you as the agent will receive an email. You would go back into the profile here under scope of appointment and complete your end of it. So just a really nice platform. Once you've been in here and kind of played around with it a little bit, I think it's something that you will take to very, very quickly and very easily.
Looks like
Any
we have
questions?
questions. Will this work on iPad?
Yep, absolutely. Yep. Work on iPad, work on like any of those. Absolutely. Yep. Be in Chrome, right? Chrome is the preference. So be in Chrome. And if you're in Chrome, here's one thing that I will point out. It can get a little glitchy. So let's say I'm in here right now and I want to leave, but I don't log out. And then I try and log in again later today. Sometimes it gets a little glitchy if I do that. So I highly recommend you to be in Chrome and log out every time you leave. Okay. If you log out every time you leave, and then it will allow you to kind of log back in a lot easier. Okay. So it gets a little glitchy if you don't log out and then try and log back in again. Why? I have no idea, but it does.
Okay, any more questions before we
Or
wrap?
anything else you want me to kind of go over or not? I could spend a few minutes in the agent center as well and just show you what's in there.
Yeah, just remember too, for some of the newer agents, that you can go out to the YouTube or go through your agent portal on IAD's site to take a look at the YouTube videos that are out there. We did one on products and that was done very well. So lots of good information there.
Yep.
So we're
So
on certification, products, CONNECTURE, and then next week we're going to be doing it on, we're going to have a webinar on DSNP. So that'll be next week, Wednesday.
So to access the agent center, I'll just spend a minute or two on here.
Yeah.
You see, once you click on that Medicare tile, not the enrollment tile, it just gives you the option, the MAPD plans, DSNP, Medigap, or a group. As you click into each one of these, it'll give you some subsets that you can access. Ton of great information in here. The problem with our agent center is there's so much good information in here that it's kind of hard to find what you're looking for. So we try and give you some headers here I will say we are going to reorganize this at some point this year. So just keep that in mind.
Mhm.
Here's some of the things that I have recommend that you put in that priority health folder on your desktop. If you click on these, it'll bring down. So here's your cell sheets, right? You can access those, download those. Social media posts I talked about, right? That you can access. Some embedded benefit flyers that you can access, So just a lot of really great enhanced dental vision, really great information in here, but there's so much. Sometimes it's kind of hard to find what you want. You need to spend a little time in here and just kind of work around a little bit. Medigap, same process for the Medigap and the DSNP. So any questions about any of that? Forms, enrollment forms, agent forms, member forms. So good stuff.
Yeah, well, thank you for doing that today. All right, well, we're gonna wrap it up. Don't see that there's any more questions. So thank you for joining. And again,
Thank you. Yeah, appreciate
yeah,
the opportunity. And yeah, if there's anything else, don't hesitate to reach out.
all right, good enough. Until next week. All right, then.
See you guys.
All right, see ya.